Welcome to Inner Compass, a podcast where we navigate through life's big questions. And today, we're going to dive into a very, very interesting topic, something that has become a norm in our society. And the question is, are we doing it right? Well, my name is Lovetti Lafua, and today we're going to be talking on epidurals. That's something many people don't want to talk about. Many people don't want to even go there because it's matters that concerns health, and people don't want to adhere to pain anymore. Of course, I totally understand that. But maybe, just maybe, it is time to take a second thought on it and look into epidurals, see if it does really as much good as it's proclaimed to do, and what are the alternatives instead of epidural. My name is Lovetti Lafua, and now let's dive right in. Whether you're preparing for childbirth, you're curious about the health achievement, or you're just navigating life and trying to know what life has to hold for you when you get pregnant, then this episode is for you. So sit down, get a glass of water, relax. We're going to be exploring following: the history of epidurals, what is inside of epidurals, some very, very rare side effects of epidurals that you might have never heard of. And finally, my favorite, the alternative to epidurals. Instead of taking epidurals, what else can we use to manage pain instead of using epidurals? Come on, let's go. For many people who have been telling me that epidurals have always been there, I agree with you. I'm not disputing that fact. But you have to understand that epidurals didn't just come overnight. Everything came at a certain time. In my research, I found out that the first time that it was introduced was in 1901 by a Spanish doctor who actually works in the military. Military? And his name was Dr. Fidel. So maybe you want to look it up. And his name was Dr. Fidel. So maybe you want to look it up on Dr. Fidel's pages. In 1921, an Italian anesthesiologist also came to know about epidurals. Of course, it makes his job easier, right? And his name, the Italian doctor, Gigliotti, I think. So you want to look that up as well. So what the Italian doctor did was to refine it using the laws of resilience method. Sort of improvised and created it a bit better. And by so doing, this enabled the proper usage of needle. And by 1930, the German machine, they advanced this method furthermore. And by the time the war was over, epidural has found its way into the new world, the United States of America. As every other thing, quickly gained a very widespread use. And of course, when the midwives were persecuted at this time, they were called old grannies. Everybody thought that the hospital was the best thing. And of course, you have the epidurals there, so you're not going to feel any pain. So it was easy to move around. By 1960, epidural had spread all over US. It has become the most used thing in the United States. And when anything enters the US, it's sort of like a virus, it spreads everywhere quickly. Sadly today, over 70% of births worldwide use epidural as painkillers. I'd like to really tell you something, sis, that you come to the understanding that epidurals are not just some painkillers or some medication. They're a mixture of cocktails of drugs. Some say it's carefully mixed cocktails designed to numb pain. But numbing a pain doesn't mean the pain is not there. So now let's go to what are the things that are very, very typical about epidurals. Now, one thing that I noticed in my research is that there are local anesthetics inside of them, or lidocaine, which actually blocks the nerves to signal numbness. And secondly, we also have the opioids. The opioids are things like Mentalin or morphine. Morphiums, the last time I heard about that, it was something that was given to people who were actually in their deathbed. But okay, this is actually what we take as women when we are intentionally signing to take epidural. And what this does for the body is that it enhances the pain relief. Then there's also the epinephrine, which is sometimes added, maybe not all the time, I'm not sure because I'm not an anesthesiologist. But this makes the effect longer. It depends when you're giving this thing Did they have to add it? How did it work for you? I think that's what it depends on before they add epinephrine or not. And finally, the saline, which we all know to actually distributes the medication effectively throughout the body. Okay, let me ask a question here. Does this mean there is no pain? In my opinion, there is still pain. There's still contractions. But because when injected into the epidural space, this cocktail or mixture, what it does is to stop the pain signal from traveling to the brain. Why worldwide this is said to provide a very, very effective relief, it is also very important to understand that for everything that works against nature, there is a side effect. Let me mention some of the very, very rare side effects that many people don't even know about. But before I start, let me tell you that some of the very normal things you will hear are blood pressure, itching, things like respiratory depression. You don't really hear about that so much. It does make sense to me when it leads to that because there's morphine in it. So when this medication spreads into the body too fast, just like morphine works, it will slow down the breathing. This is where it's very critical to get a very, very qualified person to introduce this if needed. But in my opinion, there are many other ways, and we're going to get to that. This is also a very rare one. Sometimes women experience uncontrollable severe, very, very severe shivering, chilly and shaking, like really, really shaking. Rare one that people don't know about is the Horner's syndrome. And this is when the eyelids is dropping and, the person might be sweating, but just on a certain part of the face. And it's also very, very common to see that the pupils at this time of the eyes are quite constricted. Okay. This is one that it's there, but no one really tell you that this is what led to it. And that is urine retention. I've seen it happen a couple of times that after the whole epidural scenario and the baby is even born, some women really find it difficult to excrete their urine. This is one that doctors might talk to you about. That is unexpected blood. By unexpected blood, what happens is, in this case, the medication spreads too far. Therefore, it can cause troubles and difficulties in breathing, and generally it slows the heart rate. That's quite a serious one. Another thing that I know that is something that can be experienced during this time is back pain. Now, it is common for women to have back pain for a short period of time, but I have seen that women actually have pain sometimes for years. I know women who actually had epidural and her daughter is now 9 and she still had back pain, which was the reason she wanted to have a natural birth as much as possible. There might also be delayed epidural onset. This is not because your anesthesiologists or your doctors did not do their job. It's just simply because your body didn't accept or take it as soon as it came. So most times from my experience, I've noticed that women who have this situation are those who are extremely anxious, but that's not scientifically proven. That's just my own hypothesis here. And one more to mention is the paralysis. Paralysis is extremely rare, I must say. I think from all my 20 plus years, paralysis I've maybe been seen 2 times. Women also experience severe headaches after this time, but this is not something that is very, very dangerous. It is something that is really quite common for people that take epidural. And last but not the least is the allergic reaction that this can also lead to. I tend to tell people to be very, very careful when they're making this decision of epidural. Read through properly. Don't just sign. Yes, I know you're in a hurry. Yes, I know you're in pain, but that is the reason why you have your prenatal care, because then these things can be explained to you calmly and there's no contractions at that time. And that will enable you to make very, very informative decisions. Okay, there is another method. Finally, there are methods by which you can go through contractions to which you can actually reduce the pain. One of them is the nitrous oxide gas. This gas is there. Now, it also really helps women go through this pain, manage the pain quite properly. But the thing is, it is not there for a long time. So for a duration time as epidural would have been. However, I really strongly think that instead of epidural, I rather use that gas. Like I have two devils in front of me, I can choose that. There is also the hypnobirthing. That is so amazing. I love hypnobirthing. I really like hypnobirthing because it's about you working with your body and your mind. It is something you can actually train yourself for. It's a way by which you can manage pain. I have seen women birth like wonderful, miraculous beings through this. I'm not saying that you will not have any contractions. I'm telling you, you can manage it right. Just a couple of weeks ago, about 2 weeks ago, I was attending to a woman and I couldn't tell whether she was really feeling it or not because she had gone through this hypnobirthing class and she is doing amazingly well. As when I thought that she was about 3 to 4 centimeters, man, she was almost 8 centimeters. Yes. That's what hypnobirthing can do. There is also the transcutaneous electric nerve stimulation. That is also very amazing. It's based around the sacral area. You want to research that. I still prefer this again than epidural or than the gas that the woman would take. Does this make sense? So I'm trying to give you options that you know that you are not bound to epidural. It is not obligatory. It's not like epidural is the only thing that you have to do. Our ancestors birthed more than we're doing now, and they never took these things. Think about it. If epidural is so good and it's so effective as it's said, why is it that you have to sign to use it? I mean, if you take your time to read through everything you're signing, I bet you would not sign it. So that's why you should really do your prenatal class. These are the kind of questions you want to be asking your midwife or your doctor. And finally, the last but not the least, water birth. I love water birth. My first wasn't birth in the water, but my second, third, and fourth, I did in the water at home alone. It was amazing. I think what happens there, I'm trying to just go from my own experience, is because when I sit in the water and the water was covering the stomach, I really felt the sense of relief, especially in the sacral area, because it was spreading through, the contractions were spreading through, and I feel that numbness. The moment I stand up though, I feel it again. So its pros is that it's just natural. It doesn't cause any harm. It's very soothing. You're relaxed. You at least have some breath to take without screaming, you know what I mean? But it is not long lasting, and this can stay until the baby is born. That's the beauty about it, because you can stay in the water and also give birth there. Remember, the baby is not going to suffocate when it's in the water. Don't forget that they're coming out of water to water. They don't breathe yet. They're still hanging on your umbilical cord. So, mama, don't stress. And a final thought. Epidural have changed the way birth is managed. They are not the only option. Before you take your time to choose an epidural or decide for epidural, I want you to really research it. Think, what about any other option that I can take that will cause less harm to me or my baby? So what do you think, sisters? What do you think? Would you try an epidural or opt for an alternative medicine? Make sure to subscribe to my channel, share, comment, like, and tell me your thoughts. Is there something you want me to talk about on Inner Compass, a way where we can navigate our everyday life? Let me dig into that for you. My name is Lovetti Lafua. Until next time, I want you to stay informed, very healthy, of course, and make informed choices. This is Inner Compass, and I'll see you in the next episode.